iGlaucoma presents a video series.
This is Matt Schlenker from the University of Toronto presenting our case of endoscopy-assisted transluminal trabeculotomy and endocyclophotocoagulation. This gentleman had a penetrating keratoplasty which failed, followed by a DMEC which also failed, and was sent to us for uncontrolled eye pressure and difficulty tolerating his medication with the hope of repeating his graft in the future. You can see here from this UBM that remarkably, despite his complex history, his angle anatomy appeared reasonably open. So we took an 18 gauge probe and were able to visualize the angle anatomy and make a small goniotomy here with an MVR blade and feed a melted tip 5-O-proline through the trabecular meshwork and into Schlem's canal. There was a little bit of a membrane over the trabecular meshwork which we had to navigate, and there are circumstances in uveitic or other eyes prone to scarring where we can feed the suture just behind the membrane and not in Schlem's canal. And you can see here this membrane that we're able to dissect a little bit, but you can also see the blue tint of the suture behind the trabecular meshwork, confirming our placement in Schlem's canal. And after we'd confirmed this placement, we went ahead and continued to feed the suture. And this does take some experience where there's a little bit of a tactile feedback that we're able to feel while feeding this suture. If all of a sudden we lose that tactile feedback, particularly if the patient has pain, there's a chance that we've entered the suprachoroidal space. And conversely, if there's no pain and we lose the feedback, there's a chance that the suture has gone into the anterior chamber. We're able to feed the suture a fair amount and then extract it from the eye, completing the goniotomy or trabeculotomy portion of the surgery. We weren't sure how he was going to do with the trabeculotomy, so while we were in the eye, we also went ahead with endocyclophotocoagulation of his ciliary processes to decrease the inflow pathway as much as possible. This patient has done remarkably well after his eye pressure has been in the low teens and even lower at some instances on no medications, and he is preparing for a repeat corneal graft. Thank you for watching.
Hey, want a must-need glaucoma tool that you can download right now? Grab my 2022 glaucoma medication guide in the description box below. You'll get all the most commonly used glaucoma medications right at your fingertips to help you quickly make decisions about which glaucoma drop is right for your patient. Download it now.